Do you have FND or know someone who does? If so, this is going to be a long post, but it's really, really important that you stay with me. Stop what you think you know about seizures right now, because yesterday, the American Academy of Neurology released their first ever guidelines for functional seizures, and it changes the conversation about everything. Too many people believe that seizures automatically mean epilepsy, and that if you have an MRI or an EEG done and it comes back normal, all your symptoms must be in your head. Well, this guideline directly challenges that. This guideline confirms that functional seizures look like epileptic seizures, but they aren't caused by the same brain activity. They're real episodes, but they're caused by a different brain dysfunction. So what medical providers are looking for when it comes to proper diagnosis are things like video EEG, which we already know, along with witness statements from someone who saw you have the symptoms, to include recordings from smartphones, which is really, really good because it does help prevent medical providers relying on their own assumptions. Another thing these guidelines are recommending is no longer recommending anti-seizure medications for people that have functional seizures, because the reality is we know they don't work. We've already known this. The other part to that is they can actually worsen our symptoms. So look, yes, this is a huge step in historical neurology. The fact that AAN is recognizing functional symptoms, functional seizures, and saying they do exist, they are real, and here are some treatment options, that's wonderful. But look, in my opinion, it's not enough. Because let's be honest, living with functional neurological disorder, we know CBT is not enough. There is no one-size-fits-all resource, and while CBT helps many, it doesn't help all of us. We need things like multidisciplinary treatment, so more resources to help treat our symptoms, better insurance access, better disability support, and an overall better understanding of what we are living with every single day. And that's exactly why I created my petition to push for better recognition, better care, and better outcomes for FND warriors worldwide. So now I want to hear from you. What do you think about these new guidelines? What has your journey been like? And for those of you who want to look at this information a little bit closer, I'm going to add the link to it in the comment section.